Well, there we were in a U.S. Army aircraft hangar preparing for nightly news just this past Friday at Bagram Airfield in Afghanistan, the moment when we received word that our friend, our Washington Bureau Chief Tim Russert, had died. Later on here tonight, we'll talk about the emotional reaction across this country, but something else has also happened. The death of our friend Tim has focused a lot of new attention on sudden cardiac death and what, if anything, can be done to prevent it. That story here tonight from our chief science correspondent, Robert Bazell.
Tim Russert got excellent medical care, and he knew he was at higher than normal risk for heart disease. His internist, Dr. Michael Newman, treated the risk factors.
He was on a regular exercise regimen. He took medication to lower his blood pressure, lower his cholesterol. He also took aspirin.
166/90?
2 months ago, Tim got a cardiac stress test, like this one, that showed no abnormality. Many are asking, how could that be?
It turns out that the more severe blockages in the coronaries, the ones that might cause chest pain or an abnormal stress test, are actually rarely the kinds of plaques that cause a heart attack.
Here is how that works. Sometimes the cholesterol-containing plaque can build up heavily, leading to chest pain and shortness of breath that can be picked up on a stress test and repaired with angioplasty like this or bypass. But other times the cholesterol is spread out. It can still rupture and block the blood flow, causing a sudden heart attack. That's what happened to Tim. Tim's doctor does not think his extraordinarily hectic life played any role in bringing on the heart attack.
Tim had a very stressful lifestyle. He loved what he was doing. And in that sense, while busy and at times frenetic, it was not imposing any great psychological stress on him.
Bad psychological stress can increase risk, but it is not the major factor. Doctors say the ways to reduce risk are well known. Don't smoke. Have regular checkups starting in your 40s and 50s. Get your cholesterol and blood pressure under control. Avoid or treat diabetes. Exercise, and try to maintain a normal weight. In fact, because of better care, the rate of heart attacks and sudden cardiac deaths has fallen dramatically in the past decades. But still, 850 Americans die every day from sudden cardiac death. Robert Bazell, NBC News, New York.
Sudden cardiac death is very difficult to prevent. The more severe blockages in the coronaries, the ones that might cause chest pain or an abnormal stress test, are actually rarely the kinds of plaques that cause a heart attack. The plaques that cause heart attacks are actually ones that grow outward in the artery, so they don't narrow the flow channel for blood. And for reasons that we're still trying to understand, there's some transition, perhaps it's inflammation in the plaque, that causes that plaque to fracture. When the fracture occurs, it exposes the blood to substances which cause clotting. A blood clot then forms, shuts down blood flow to the artery, and in about a third of those patients, they will have sudden death. They won't make it to the hospital. Now, if you get to the hospital, if you're in the 2/3 of patients that have a plaque rupture with a heart attack that actually make it to the hospital, we could do a very good job of getting you through the episode. But we've not been able to reduce the incidence of that 1/3 of patients that never get to the hospital alive.
Stress, it's everywhere, and before you know it, your heart is racing.
Are you angry? Are you stressed? Are you depressed? All of these things have profound effect on your health.
Effects like real pain, fatigue, sleeplessness, and even lasting disease. The symptoms cause more stress. It's a vicious cycle that can land patients in the hospital.
You wake up and you're dealing with pain, and it's with you all day.
Blythe Stokes says for her it all started with a difficult divorce, the death of her father, and several pets.
So all of that hit at once, and it was very difficult to deal with that mentally.
Blythe sought treatment at the Scripps Center for Integrative Medicine in La Jolla. Dr. Mimi Guarneri is the medical director here.
What I see in my practice is they've been to 3 other physicians who have told them there's nothing wrong, Don't worry.
But Dr. Guarneri says the symptoms are real. She says when a person is under stress, hormones are released, triggering a flood of biochemical changes that can speed up your heart and suppress your immune system. Over time, it can be deadly. Dr. Guarneri says the cure is a comprehensive treatment of mind, body, and spirit.
How do you start to learn to shift your body the minute you feel anxious to get to a more neutral position?
Close your eyes and just listen to the drum.
The Scripps Center empowers people to get control of their lives by learning to identify stress triggers and controlling the response. They offer a 3-month lifestyle change program where classes like music therapy help patients de-stress.
Good to see you. How are you?
For Blythe Stokes, it's a different kind of therapy. This is the IS-3 device, an acupuncture-based treatment that hooks up to the ear to help reduce pain, insomnia, and anxiety. Blythe Stokes suffers from sciatica and fibromyalgia.
The IS-3 has been absolutely amazing.
I probed the ear.
The Scripps Center was one of the first in the country to use the IS-3.
Doing okay?
For 4 days, its battery-powered microchip sends impulses through small needles placed in sensitive spots on the ear. Dr. Robert Benakdar says it sends a message through nerves directly into the brain, often breaking the cycle of pain for the patient.
So it's sort of a pain treatment that goes home with the patient and is minimally invasive.
Blythe has used it more than a dozen times.
She was treated one day. She was using a scooter to move around, and when I saw her back, she was walking.
Dr. Benakdar says before mental anguish transforms into physical pain, put your stress in check.
Is your heart racing? Are your palms sweaty? Do you feel like you were less there for that person you're interacting with?
Music therapy, meditation, good nutrition, exercise, and deep breathing are key components of the doctor's prescription to keep from stressing yourself sick.